Hey guys, and welcome back to Clinical Physio with me, Khalid Maidan. In today's video, we're going to be taking you through the importance of resisted tests. First of all, what are resisted tests? Well, these are muscle tests where attributes of muscle contractions, such as endurance or strength, are analysed. In the orthopedic model, which we use as a staple for our clinical assessment process, resisted isometric tests are specifically performed to determine whether or not a muscle contraction results in pain and/or a weakness as a part of our patient's condition. A mid-range position is used for these tests as this allows for maximal muscle contraction, but with minimal shearing of joint surfaces. So when we're looking at resisted tests, we need to think of two key things: pain and power, the latter of which can be measured on the Oxford scale between 0 and 5. And when you look at our resisted tests within the clinical physio catalogue, such as resisted tests of the knee or resisted tests of the elbow, these two things are always considered. In terms of pain, we can use our resisted test to see if we can reproduce the pain our patient has reported in their subjective history. Even more importantly, the reproduction of pain during a resisted test may indicate that the pain is linked to the muscles which are controlling the movement in that test. So for example, if our patient has an issue with hip adduction, adduction, and resisted isometric adduction is painful at the proximal adductor region, this may well indicate that the hip adductor muscles are contributing to our patient's problem. As we said earlier, in terms of power, we can rate our patient's strength on each resisted test on the Oxford scale between 0 and 5. Furthermore, we can get even more information when the analysis of pain and power when we're looking at the resisted test is combined. So let's consider if our patient has no pain and full strength on the Oxford scale during ankle plantar flexion. Well, this would seemingly indicate no issue with the plantar flexors of the foot. If the movement was very strong but pain was located at the Achilles tendon during resisted plantar flexion, this may indicate a contractile lesion of the plantar flexors. This situation can occur often when the plantar flexors are overactive. The constant use of the plantar flexors leads them to being very strong, but at a level which they cannot cope with. So if you find this with your patient, consider if other muscles, such as the hip extensors for example, are too weak. This might lead to the plantar flexors being overly active during activities such as walking. So let's take a different example. What if the movement was not painful, but it was very weak? Well, this may well be the case if there was a neurological cause for our patient's weakness, whether it be a myotomal problem linked to the lumbar spine, if we were taking the same example of the plantar flexors of the foot. It could be a peripheral nerve issue, or perhaps a central issue, such as an upper motor neuron lesion. However, this presentation may also be consistent with a complete tendon rupture of the Achilles. If the muscle is relatively weak, i.e. graded as a level 4 on the Oxford scale, for example, this may indicate that the muscle is simply underactive without the presence of significant pathology. Finally, let's consider a situation where there is a notable weakness and the movement is painful. Reasons for this may include a partial rupture of the Achilles tendon, or in other instances, a potentially more serious pathology, such as a fracture. And that completes our video titled Why Test Resisted Movements. Next, I'd like to suggest you have a look at our other videos within the Why Test section of our Clinical Physio Premium catalogue, including Why Test Active Range of Movement and Why Test Passive Range of Movement. Thank you as always everyone for joining us, and we'll see you again very soon, right here on Clinical Physio.